Pterygium. Pterygium is among the degenerative conditions of the conjunctiva. Pterygium is defined as a degenerative condition of the conjunctiva, which appears as a triangular fold on the bulbar conjunctiva. Pterygium is an external eye disease or disorder which is notably known for its insidious advancement or progressively over the cornea. It is commonly located nasally, though may occur laterally. Pterygium affects all ages, but is believed to affect women more than men because women are more exposed to irritants such as cosmetics, and for those who live in the village, smoke from the firewood. So this pterygium is some sort of a defect that can lead to blindness, because this particular disorder tries to grow and cover the cornea, and you know that the cornea is the transparent portion of the eye, which its primary function is to enable light rays to pass through and reach the retina, so that the retina can generate impulses that are used for image formation in the brain. So this pterygium is some sort of a tissue that tries to grow over from the sclera. It will gradually be approaching until it gets to the cornea, where it causes serious corneal opacity. Like we said earlier, there are many risk factors for these conditions. The predisposing factors are environmental irritants like dry, dusty area, people who are occupationally exposed to some hazards that affect the cornea, such as cement factories, glass industries, etc. However, the most notable predisposing factor is when a patient has pterygium. This is some sort of scar growth on the sclera. Though the actual cause of this pterygium is unknown. If you look at your screen, you will see it there. Types of pterygium. We have two types of pterygium. One, true pterygium and pseudopterygium. The reason for this classification or naming the types is based on if the pterygium is attached all through the underlying structure or is just adherent on the cornea. So we say that someone has a true pterygium when the pterygium is attached very well on the cornea or on the sclera. Then we say that a patient has insidious pterygium when the pterygium is just adherent on the sclera and the cornea. Parts of a pterygium. Pterygium has four distinct parts that are which may not be easily distinguishable. However, one can still state it clearly. The first is the head. The head is the apex of the triangular growth, and it lies on the cornea. The next is the neck, which is the part on the limbus of the eye. You know that the limbus of the eye is the junction between the sclera and the cornea. You will see it on your screen. Then the body. The body, which is the part on the sclera. The body has more surface area than other parts. Then finally, the base. The base is the vertical end of the pterygium. That is from, if you look at that base of that pterygium, it looks like the base of a normal triangle. So in general, by the time you look at this pterygium on the eye, as I see it on the screen, you will understand why they say it's a triangular growth on the eye. Stages of pterygium. There are four stages of pterygium. They are stage 1, incipient stage. At this stage, the pterygium growth is noticed to have reached the limbus, or is just crossing the limbus. So at this point, we now say this is stage 1 pterygium. Stage 2 pterygium. At this stage, the advancement is increasing, so therefore we call it advanced stage. The apex of the growth is between the limbus and the pupillary margin. You will see the pupillary margin as that inner part inside the cornea. Look at your screen, you'll see it there. It has reached that point. The next stage is stage 3, critical stage. At this stage, the apex of the pterygium has reached the pupillary margin. Then stage 4, pterygium blindness. At this point, the apex of the pterygium has covered the pupillary axis, so it now prevents light rays from going into the retina. This is also known as opacity of the cornea, or corneal opacity. Clinical features of pterygium. Pterygium has a triangular conjunctival growth, as you can see. That's one thing you know about it. Redness of the eye. Most of the eye conditions that are affecting the conjunctiva leads to redness because the conjunctiva has rich blood supply. Grittiness is another symptom. Grittiness is the feeling of a foreign body on the eye. So the person will be feeling that maybe a date is on the eye. Astigmatism. Pterygium can provoke corneal disfigurement, which can lead to astigmatism. The base of the lesion of pterygium will always face the canthus. Lastly, pterygium can also be symptomless. That is, does not present any symptom in a particular patient. Management. Pterygium is managed under the following. Clinically, history taking. You ask the patient, when did this begin, or how far has this been happening? Then you now ask for possibility of other related symptoms, like, are you feeling pains? Can you see clearly? Is it itchy? And all that. Then we now move down to examination of the eye. This can be in form of inspection. Then visual acuity. This is to test if the patient vision is already failing due to this disease or disorder or growth. Then use of steroids. Use of steroids is to limit the growth of this pterygium. And finally, surgical removal, mostly performed by ophthalmologists. The name of the surgery is called Beresclera method. However, in advanced nations where corneal grafting is possible, these persons who are at stage 4, that is when there is corneal opacity, this surgery, keratoplasty, can be carried out. Complications of pterygium. The following are the complications that might follow pterygium. 1. Subconjunctival hemorrhage. 2. Lateral and medial rectus detachment. You know that the lateral and medial rectus muscles are among the recti muscles that control the eye movements in lateral and medial ways. So they can detach if this pterygium affects them. Corneal and scleral perforation can occur. Corneal oedema. Squint. The patient might have squint if the recti muscles that control the eye movement is lost. Infections. Secondary infections can also occur. Granuloma. Diplopia, that is double vision. And most times, reoccurrence of this condition can occur. That is why, even after the surgery, the patient is placed on certain drugs, which is believed to prevent its reoccurrence. Finally, corneal opacity. These are the complications of pterygium.